Good evening, everybody. My name is Dr. Candy Buencamino-Francisco, and tonight I will be talking about the clinical presentation, diagnosis and management of COVID-19 in the ambulatory setting. Next slide, please. So before we talk about the symptoms of COVID-19, it is important to know how SARS-CoV-2 spreads. So the main mode of transmission of SARS-CoV-2 is by person-to-person spread via respiratory droplets, especially when in close contact with another person. And close contact is defined as staying within 3 feet of another person. SARS-CoV-2 can also be spread by contact with contaminated surfaces or objects. So if you touch something that is contaminated with a virus and then you touch your face, your eyes, your nose or your mouth, then you could potentially be infected. Next slide, please. So there are a few studies that have shown that SARS-CoV-2 can survive on surfaces from a few hours to a few days. However, it is important to note that this study was done in the lab, and some experts believe that as the virus is exposed to the environment, its genetic material deteriorates and may not be enough to cause an infection. Nevertheless, it is important to always practice good hygiene, and not just to prevent COVID-19, but to prevent other infections as well. Next slide, please. So the coronavirus can also spread by asymptomatic transmission. So there are individuals who do not show symptoms of COVID-19, but carries the infection. There are also pre-symptomatic transmission, which is, so individuals who are infected with COVID-19 can spread the infection up to 48 hours before the onset of symptoms. However, the risk of transmission is thought to be greatest during the symptomatic phase, where there is the highest viral shedding. Next slide. The incubation period of COVID-19 ranges from 2 to 14 days, with a median time of 4 to 5 days from exposure to the onset of symptoms. So meaning if you've been exposed to somebody who has COVID-19, it may take up to 14 days for you to develop symptoms. And that is the basis for our 14-day quarantine recommendation. Next slide, please. So let's differentiate quarantine versus self-isolation. A lot of people get confused with this terminology. So quarantine is used to keep someone who might have been exposed to COVID-19 away from others. So you self-quarantine when you're exposed to somebody with COVID-19 infection. On the other hand, isolation is used to separate sick people from healthy people. So for those who have been diagnosed with COVID-19, isolation is appropriate whether in the home or the hospital, depending on the severity of symptoms. Next slide. The clinical spectrum of COVID-19 may range from asymptomatic, so having no symptoms, to minimal symptoms, paucisymptomatic, to severe symptoms. Next slide. It is important to note that 81% of people who get infected with COVID-19 will have mild to moderate symptoms, 14% will have severe symptoms, and 5% will have critical symptoms manifested by respiratory failure or multi-organ failure. Next slide. The most common symptoms of COVID-19 include fever, and this is typically high-grade fever that is poorly responsive to medications such as acetaminophen or ibuprofen. They can also present with dry cough, fatigue, loss of appetite, shortness of breath, sputum production, and muscle aches. Other symptoms include headache, confusion, runny nose or nasal congestion, sore throat, bloody sputum, nausea, vomiting, or diarrhea. And some people may have these gastrointestinal symptoms even prior to the onset of fever or respiratory symptoms. New loss of taste or loss of smell are also considered as symptoms of COVID-19. Next slide, please. So dermatologists are now recognizing more skin manifestations of COVID-19. And these skin manifestations can range from a dengue type rash or an urticarial type rash like the hives on the second picture. And more recently, we're recognizing this phenomenon called COVID toes. And this is characterized by reddish purplish discoloration of the toes that is thought to be due to inflammation causing microclots or clots in the tiny blood vessels on the toes. Complications of COVID-19 can include heart damage. So you can present with myocardial infarction, heart attack, inflammation of the heart, or heart failure. Blood clots, damage to the nervous system, which includes seizures, stroke, loss of balance, and brain bleed, as well as kidney damage. Next slide, please. So what do you do if you have these symptoms or you think you may have COVID-19? So the first thing to do is call your doctor or healthcare provider and explain your symptoms over the phone. Do not just rush right away to your doctor's office to minimize the risk of spreading the infection. Most of the doctors are now doing telemedicine or virtual visits and may be able to manage your symptoms over the phone. If you need testing or need to be seen, your doctor will be able to direct you to the appropriate location. Next slide, please. When do you seek emergency care? So this is very important to know, to recognize these warning signs and know when to get medical attention right away. So symptoms include trouble breathing, persistent pain or pressure in the chest, confusion or altered mental status, bluish discoloration of the lips or face, which indicates low oxygenation, severe dizziness or feeling faint. Next line. Risk factors for severe COVID-19 illness includes age. So those older than 65 years old is considered as a strong risk factor for severity of illness, complications, and death. In the United States, death is highest in those who are older than 85, with a fatality rate of up to 27%. Those living in the nursing homes and long-term care facilities are also at high risk. Next slide. People with comorbidities, including chronic lung disease, serious heart conditions, those who are immunocompromised, such as those undergoing chemotherapy, smokers, transplant patients, those with immunodeficiencies, and those taking medications that can weaken the immune system are at high risk. Obesity is also considered as one of the risk factors for severe illness. Diabetes, high blood pressure, those with chronic kidney disease, undergoing dialysis, and liver disease are also at high risk for severe COVID-19 illness. Next slide. So how do we diagnose COVID-19? So the test is called RT-PCR, and PCR stands for polymerase chain reaction, which is a test that detects the amount of the virus's genetic material. So the most common sampling technique is called the nasopharyngeal swab. And this is an illustration of how we collect sample from the nasopharynx. So the clinician inserts a 6-centimeter swab through the nostril and goes back to the back wall of the nasopharynx. So that swab stays there for about 10 to 15 seconds to ensure adequate sampling. Other samples can be obtained through throat swab, nasal swab, and saliva, depending on the type of test. The turnaround time for the COVID-19 PCR testing has significantly improved as these testing supplies become more available. So the turnaround time can be anywhere from 15 minutes to a few days, depending on where you go for testing. Next slide. So this is just a list of testing sites in the different states. So if you're interested to know where are the testing sites in your state, I would recommend to go to your state's Department of Public Health's website. Next slide. So what are the priorities for testing? So these priorities for testing are constantly changing. So at the beginning of the pandemic, the CDC and the Department of Public Health released 7 categories for testing. And that's because of the limited testing supplies. Fortunately, due to the increasing availability of testing supplies, the criteria have broadened. So as of a few days ago, they had 3 priorities for testing, but as of today, the priority of testing has changed once more. And they now have just 2 categories for testing. We have the high priority group, which includes the priority 1 and priority groups listed on this slide. And then the priority group are those groups that are listed on the priority 3. And they're now considering asymptomatic individuals as priority if recommended by their clinicians or health department. Next slide. So what about SARS-CoV antibody test? Right. So I'm sure you've heard about this on the news. So antibodies are proteins in the blood that are produced in response to an infection. The SARS-CoV antibody test is not used to diagnose or screen for COVID-19 infection. This test helps us determine whether one has been exposed, infected, and recovered from COVID-19 infection. This antibody test may also help researchers better understand how our immune system responds to this infection, and also help identify people who may be less susceptible to the infection. This also helps identify potential donors for convalescent plasma, which is now being studied being studied as one of the potential treatment options for severe COVID illness. Next slide. So as with any kind of testing, these antibody tests is subject to limitations. So the test needs to be calibrated, validated, and reviewed by experts. Second, the level of antibodies that confer immunity to SARS-CoV-2 is still unknown. It is also unknown how long these antibodies remain present in the body after the infection has been cleared, and also subject to false positives and false negatives. So currently, the FDA is working closely with the NIH and CDC on a validation project to help identify the most promising serological tests. This validation project is ongoing, and we hope to have additional information pretty soon. Next slide. So how do we manage COVID-19? So the decision to manage patients in the inpatient or outpatient setting depends on the severity of the disease, the comorbidities, risk factors, and ability of patients to self-isolate at home. Many patients with mild to moderate symptoms can actually be managed at home with symptomatic treatment. And for those with severe disease requiring hospitalization, there's no specific treatment that has been FDA approved to date. However, there's one antiviral medication called remdesivir that has just gotten emergency use approval or authorization from the FDA. This is used for patients who have hospitalized patients who have severe COVID-19 illness. It's given intravenously, and preliminary studies have shown that this can shorten the hospitalization stay by up to 4 days. However, the mortality rate is not significantly different from the placebo group. There are also several medications that are currently under investigation, and multiple studies on vaccines are also underway. Next slide. So if you've been diagnosed with COVID-19 or think you may have COVID-19, these are some of the recommendations on how to protect yourself and protect the people at your home and in your community. So I'm sure since we don't have FDA-approved treatment options for COVID-19, the management relies on supportive treatment. And I'm sure you've heard about this several times, staying home, staying well hydrated, take fever-reducing medications, make sure you wear a mask, wash your hands with soap and water for at least 20 seconds, or use a hand sanitizer with at least 60% alcohol, avoid sharing personal household items, and disinfect high-touch surfaces every day. Next slide. So if you've been diagnosed with COVID-19 and was advised to self-isolate, when can you end self-isolation? So these are guidelines from the CDC, and it's composed of 2 categories. One is with testing and the other is without testing. So if you will not have a test to determine if you're still contagious, you can leave home if you've had no fever for at least 72 hours without taking any fever-reducing medications, and symptoms have improved, such as cough or shortness of breath, and at least 7 days have passed since your symptoms first appeared. If you will be tested to determine if you're still contagious, you can leave home if you no longer have a fever for 72 hours without taking any fever-reducing medications, and symptoms have improved, and you received 2 negative tests in a row, 24 hours apart. Thank you all for listening. This is my last slide.